for electronic health records and data from social media, health data from social media. It's my pleasure to be here to give an overview and introduction of what the potential of AI for healthcare transformation and what are the challenges. So the outline of our talk today is we are going to okay, sorry for this. Yeah, we are going back to our slide. The first of thing we are going to starting with outline. We're going to discuss why we need AI for healthcare, the significance of AI for applying AI in healthcare, and why it's the time and right time to apply AI for healthcare, and what are the potential of applying AI for healthcare. And the second thing is we're going to just uh, introduce some kind of deep learning for some kind of deep learning algorithms for healthcare. And we are not going into technical details in this part. We just discuss the general overview of this algorithm and most common algorithm. And then we're gonna discuss the type of healthcare data and the most common type of healthcare data and how we can connect this algorithm with this type of data to create some potential application. Then we are going to discuss the main challenges behind this and what are the potential future work. So overall, the aim of this topic is not to deep insight, but to give overall what the potential of AI for healthcare and what are the research direction in this topic. So why we need AI for healthcare? Why it's time for AI for healthcare? The AI, the concept of AI for healthcare is going to have a lot of potential in saving doctor times. For instance, if you say when you are visiting a doctor, most of the time doctor is spending is documenting the symptoms you have, documenting the analysis and diagnosis you have. So a lot of time is spent in documenting this in electronic what's called electronic health record about the patient, and a lot of time is spending with documenting things, and sometimes for unnecessary thing or that's unnecessary for patient, just like the insurance, health insurance, or kind of other task that patient at the end of the day will not benefit. So the AI for healthcare is going to save time. It's bringing us back the real medicine, which is about empathy, care for the patient. So AI will take care of all these things regarding to writing down the symptoms that doctor discussed with the patient, to take care of the clinical notes, to analyze these clinical notes, and bring also when you're visiting a doctor next time, you don't need to go through a lot of text that has been written by nurse or by another another caregiver. So he will have only the significant information that he needs to read it before he meet the patient, which is one of the significant part of applying AI for healthcare, is saving doctor time. Now, if we save a doctor time, he is going to look after the patient more carefully and more with some empathy, with some presence, with being a human. Another thing is very common here in the United States is to reduce the cost. The cost of healthcare is going up and up, and sometimes the cost of healthcare because of some kind of uh, expensive, like scanning is expensive, or image like the radiologist cost and other stuff cost. So if that part is taken care by AI, then that will be the reduce of that part will be significantly decreased. Another thing is kind of understanding the information of patient. Now we have a lot of information regarding the patient. A lot of that information are from electronic health, from image, from, for example, genome sequencing, and from other different type of data. It's kind of very difficult for a doctor to look all this data and information about patient and come with a conclusion. The concept of AI now is connecting all this data together and bringing a doctor like a summary about that patient, a simple summary about me. That's the potential of AI and the hub of what AI will bring for us. Thirdly is applying AI for collective experience. So when we are taking AI and, for example, a deep learning algorithm, we are taking historical data. The historical data, for instance, from different doctors with different experience on analyzing, for example, an image, and we give it to an algorithm that will be learning from collective experience from the different doctor. So it's the algorithm learning from this experience and applied into the future data. So kind of learning collective experience from different doctor, from different perspective, and from different analysis. This is very important. For example, in real case or rare disease, some doctor will not have that much experience, or maybe not meet a lot of patients with that disease. So he will be overconfident or biased according to his experience. But if we success to bring diverse data and to train a deep learning algorithm in diverse data from different doctor with different experience, we are teaching a lot of experience from a lot of people. So it's kind of reading a book of experience from different doctor. Another thing is saving patient time. This is also a very significant factor. For example, a sick person who go to hospital, he needs to fill up a lot of documents, and you need to write down a lot of information which already in the system, and he will be spending like 15 minutes 20 minutes just writing information which is already in system and confirming that. So if we have AI that can recognize what type of information we need for a specific patient for this visit, and we can save time of sick person who's, I mean, sometimes barely can talk or can write. Another significant, also important of deep learning for healthcare is diagnostic error, which is kind of there is like in the United States, the third cause of death is coming from the medical error that is can be preventable. Third cause of death. So sometimes human have kind of bias towards analysis, and sometimes is the mistake from human cannot be neglected easily. So can AI provide us a second the second opinion and can reduce diagnostic error? And the last potential application is to do for some kind of task that's very difficult for human to do, for a doctor to do, for clinician to do. This kind of task is connecting a lot of data together. For example, from the patient DNA, from patient RNA, from a lot of different records together, and bring it to a conclusion from the sensor itself, from the image, from the text. So the time for a doctor to read all these documents and analyze it, even the doctor is smarter and more intelligent than a machine, but the time he needs to connect the patterns between all this document and come with a conclusion is very very high. So the deep learning or AI in general, it's not a magic tool, but it's like high it's connecting a lot of patterns from different type of sources to come with conclusion. So at the general as a conclusion, it will not replace a doctor at all, but it will augment the performance of the doctor. It will provide a second opinion for the doctor. So why nowadays AI is very important? What makes AI right time for AI nowadays? Actually, with increasing a lot of big data, and this big data are now digital data and well documented in kind of electronic health records or image, medical image, or different type of data. For example, each patient will have a like medical imaging, and each patient will have a sensor. Sensor can be wearable sensors. Even your phone is a sensor for collecting your behavior, your food, your exercising, and also from different like psychological metrics and genome sequencing and electronic health, I mean, records, and also even from your social media, which is very important to discuss about mental health and how you express your opinion in that. So we have multi-dimensional data from different resources, and with single aim is to understand the patient and give a better care for that patient. So this is very important factor to bring the AI nowadays. We have data, we have the data, and that it's a huge data. The second thing, we have the computational power. The computational power with GPUs and computer nowadays is becoming very powerful, and we can analyze a lot of data that never was before. The third is, as we mentioned before, is the human has a limited power. Clinician has a limited power to connect big data. Sometimes it's not about intelligence, it's about pattern reconnection. We need to connect all patterns from different sources. So human have a limited in that one. Human is smarter than machine, but has a limited to connect all patterns together and come with a conclusion. Another thing is that it's big data-driven population health analysis. We need to study human at large scale at a lot of people included in this study. So we need to analyze this at large scale. If we have a big data, we need to understand a large scale. Previously, I mean, in some kind of a study like survey, questionnaire, they included like some small sample size from interaction with patient, I mean, in person, for example, survey or questionnaire. Nowadays, with this data, with this huge data, we can replace it to be a population level analysis. So all this said, we need to define what is exactly that deep learning, or what is AI exactly. So for healthcare or for another application, AI is in a simple word is pattern recognition, is taking the data as an input and connect it or map it through mathematical function to understanding the patterns and come with a, for example, prediction or prediction. So we have like input like image, for example, CT scan or any type of image. And we have also the output. The output can be different type of cancer, for example, breast cancer, whether it is breast, there is a breast cancer in this image or not. So we are taking example, we are sending that example through mathematical functions that consist of weight and bias, and we are through forward and backward propagation. We learn every pixels, how every pixel contribute towards the output. So this weight and bias will make some experience, will learn some experience, and once the model is fit and once the model is performing well, we apply it on test. The test data is kind of held out from the training. So we are testing our model whether it learns from what we have given or not. This is the same thing can be applied for text. We have a text from, for example, from electronic health records or any type, from social media or any type. And we have also temporal data, time related data. And we will give one examples when we go forward in this slides. So in generally, this is the general type of AI for healthcare can be generally divided into three types. I mean, it could be other types, but this is a very common general types. So the first one is supervised learning. And in supervised learning, we, for example, in this example, we have, for example, printer, server, then tab, pack, rack. We need to identify, even this is looks like similar, we need to identify them. So we have a label in supervised, for example, deep learning or supervised learning in general. We have an input. Input is the image or text or anything. And we have like output, which is labeled. It can be labeled by human. For example, radiologist will see to the image and see this is a cancer, this is not a cancer. So we label that one with help of expert, or it can be labeled automatically. For example, in health, in electronic records, we have like the patient timeline from different visit up to his death. So it's we have a like whole scenario, whole story of patient from beginning to the end, and it is automatically labeled with time. So what is the function of the supervised? Supervised, it takes the input and output and map it together to learn it through deeper layer. We need layer with different weight and bias and activation function until it recognizes this pattern itself. For example, from traditional machine learning, we have support for vector machine and random forest as an example of supervised learning, and from deep learning we have like CNN and RNN. The second type of the building model with the supervised learning is normally fixed process, even it's different from application to application, but in general process we have a training data. A training data is what we train a model, and evaluation data is the data we need to evaluate the model during the training type. And we have the test data that we test the model and get the matrix. I mean the performance matrix based on the test data. So the first step is to create a training evaluation test, then select suitable algorithms. Here what we mean select suitable algorithm. For example, image have CNN. I mean the algorithm mostly suitable for images is CNN. And for example, for text is a sequence. We need another algorithm that's recurrent neural network. That's kind of sequencing things together. Even similarly, the time-based algorithm, we need also RNN. So after selecting the algorithm that is suitable for our data type, we need to training and evaluate the model and then report the performance matrix. This is a general process. You find it in all supervised learning process. So the second thing here it's kind of unsupervised deep learning. In this or unsupervised learning, in this kind of learning, we don't have a label. We don't have the output ready for us, but we need to cluster the data together based on their similarity. For example, patient 1 and patient 2 have the same timeline. I have the same, for example, process of getting the disease, so that we can predict some kind of disease based on the similarity between this patient similarity. And one kind of this algorithm is about GAN, generative adversarial network, which is kind of generating the image by itself by learning from some image and then generate image itself. And this is can be used in healthcare for generating realistic image for image augmentation. And the third learning process, or the third learning algorithm, is about reinforcement learning. RL is enable agents to learn effective strategy in sequential model from trial and error interaction. So in this, the concept, this can be applied for diagnosing, decision, or treatment, which is our, typically by continue and sequential. It's sequential procedure, and it has application like dynamic treatment and drug discovery. However, up to this point, the most common algorithm that used is supervised learning. This to other learning approaches is kind of getting popularity among the researcher, and they have a potential also in the future. So we have the algorithm. So the main things for the algorithm, we needed data to fit that algorithm and come up with a model. So the data of a simple classification of healthcare data, we are having different type of data, starting from image, from the image of, for example, MRI, CT scan, and different type of image, X-ray. So this is the image that called medical image, and we have a text from what, for example, nurse or doctor are in clinical narratives and clinical notes, what they are writing, the interaction and the conversation between a doctor and a patient, that comes in text data, which explain, for example, physical data about the patient, historical illness if he has some kind of previous illness, and current symptoms also all are described in text data. And temporal data, for example, from data from sensor, or even from clinical electronic health records, can be converted also to kind of temporal data to study the timeline of patient. And tabular data is kind of lab test when you come with some result, or demographical data such as gender, age. Then the last is a fusion of multi-data types that's coming from all this above, and together to represent the patient from different records. So starting with the first one, the image data. So we have image data. We are having deep learning algorithm, for instance, CNN. So what we are going to do with this image data, what deep learning can help us to do? The first thing deep learning can help us to do, image classification, is a simple and very common. You put the image to the deep learning algorithm will tell you, is there, for example, cancer, for instance, or not. You put the image as a whole. This is called image classification. Then object detection. You are putting the image, but you want to see where is the mass of that cancer. You have to divide the image into several parts, and you can recognize this left part of mass, that's right part of mass, or for instance. And then segmentation is type of, you take the image, you divide it into small part, a small useful part. So it's kind of the first step, so the doctor can see, for example, organ segmentation, this part is what, and that part is what, and it can make the process for a clinician more easier. And the registration, we have, for example, different modality of the image. We need to alignment that image, we apply the registration button. So what are the application of this kind deep learning with image data and with this usage? It can be applied for skin cancer, it can be applied for breast cancer, it can be applied for lung cancer, prostate cancer, leaf tumor, hub fracture, diabetics. There is a lot of opening opportunity of this, and there is a rise application in different. So whether, I mean, the opportunity here as a researcher, whether you have to look complex problem and you have a current algorithm. I mean, you use the current algorithm and apply it to existing problem to solve it, or to take the problem itself from the healthcare problem, for example, in image, and study it and design algorithm that is exactly for this kind of issue related to kind of this type of image or this type of disease. Secondly, for example, here we have skin disease. We have like 12 type of skin disease. From each types of skin disease, we have a set of data in our training, for example, and after that we apply deep learning to classify which type of skin disease. This is a very powerful application maybe in the future. So you can just, if you have any skin disease in your if you have it, then in your mobile, in your phone, you may have an application maybe in the future. You just scan your skin, then apply to that application. It can scan you, then after scan you, it will say probably it's this type of disease, and if it is very dangerous, it may recommend you to nearby clinician or nearby hospital. It's kind of creating recommendation based on understanding, and easy and accessible even for people outside of the city if they have the application. Everybody nowadays has a mobile. If they have the accessibility to the internet, if they have a phone, smartphone nowadays, then the future will be very bright for these people, and the healthcare system will be easy for them and more cheaper than current one. So the second type is the text. We have a text classification. The text classification, we put the similar like image, we put the text that describing some kind of disease, for example, cause of death. Then you say, after reading this text, what are the cause of death? If you have like 10 types of cause of death from the autopsy report, then you say, okay, that's kind of cause of death this report is talking about. Then name entity recognition is to clinical concept extraction, to extract the type of disease that is mentioned in that notes, to extract also the medication from that notes. And relation extraction is kind, for example, to connect, for example, the medication with the dosage and how many times every day and for how many days from the clinical notes. And kind of text summarization. Text summarization also has a very high potential in the future. For example, it's saving the time of the doctor. When you go to doctor, if you have a like recording device which is recording your speech, then transfer that speech to kind of text. Then from that text you are summarizing what the conversation is. You are saving your time, you're saving your doctor time at itself. Then AI is taking care of all these things, and the doctor and patient are focusing only in the skills that require exclusively human skills. This is example of text classification. For example, from radiology, from pathology, we read every section. Then from that section, we create events. And from that events, we create relation between themselves and concept understanding themselves. It's kind of converting all unstructured data in the clinical, for example, into structured events. A structured event is easy to understand by a doctor and easy also for deeper analysis. The third type of data is temporal data. This is kind of coming from devices, and it can be used for human activity recognition, and it can be used also for disease prediction. If you have like kind of some timeline and you are following that timeline, the following, I mean the symptoms of a disease can be predicted in early stage. And it can be also for workload prediction and patient timeline. It can also used for in heart disease prediction and readmission, how many people can be readmitted in the hospital and how many number of new admission in patient. If we read this temporal data from the electronic health records, then analyze it and give the connection and patterns, we can get some insight. This is our example from previous published paper of turning the data into timeline of people. So you have like notes, order, vital signals, then you turn it into timeline. Each patient will have timeline. Then from that time you predicted if there is, for example, disease risk. If you are, for example, I have your, for example, sequencing or data, I can predict if you're going to have some kind of cancer based on the previous experience from previous patients. So you will be creating like there is a timeline for you, and how many types of disease or how many mutations in your, for example, DNA and all those stuff. Then you can connect it together and predict what is next. Another type of health social media data, which we are nowadays also working in COVID-19 from social media and other stuff, this can be useful, for example, for pandemic prediction. For example, if you are using social media, for example, Twitter or Facebook or something, then you tweet something like, I have a fever today and there is a cough, and you specify your location. So extracting that data, I can know in this location there are like 3 or 4 people are suffering, for example, from these symptoms, for example, flu. So I can predict if there is increasing number from social media and predict when will the second outbreaks will happen. And also population level surveillance, for example, for example, depression prediction. I can analyze the city for a specific, then extract that Twitter from that specific city and analyze whether they have like depression prediction within that city or not. This kind of population level surveillance. And also mental health condition. Let me give you one example of using the health social media data we are doing nowadays. For example, the automatic breast cancer cohort detection from social media for studying factors affecting patient-centered outcomes. Actually, the breast cancer, even especially in the United States, because and high-income countries, the mortality rate has been reduced significantly due to the advanced treatment like hormone therapy. So there is no problem with the cure and the treatment. The problem now is that some young people, young women, they don't continue the treatment due to the patient outcomes like depression, anxiety. When they do the treatment, they get the depression and anxiety, and this depression and anxiety are not documented in clinical notes and are not noted by doctor sometimes. And the good things is to look for their social media and to look to social media to understand whether this type of patients they mention their side effects related to their treatments. Understanding them through social media lens will give us insight and how we can give recommendation to the clinician based on population level wise. So if they have some kind of side effect of a specific medication and that's not mentioned during the visit of a doctor, or that not mentioned generally in electronic health records, then this is social media analysis of the survivor of breast cancer or the patient of breast cancer can give insight for the doctor and uh, uh, can react accordingly based on this recommendation from the secondary data. If you see this table, how many of these breast cancer have mentioned about, for example, their uh, nausea, fatigue, anxiety, depression, suicidal tendency. It's very real. People have mentioned it in either clinical notes or Brigger's notes or historical and physical notes, which mean even though there is advanced treatment, even though there is a powerful medication for a specific disease, but there are other side effects that like depression or anxiety that make the patient not to continue the treatment, and it cause them maybe recurrence of the disease or sometimes death. So there is psychological and mental health is very important. We can capture that side effects from social media, and it's very important for the doctor to know about the side effect of such medication. And this is generally how we have designed from Twitter to extract some sample data regarding to the breast cancer survivor. Then we train a model to understand their mental health and I mean what they I mean how they self-reported themselves. If they self-reported as a breast cancer, then we extract the tweets and we save it in our database. Another very significant application, I mean, due to the limited of time, but there are a lot of application in healthcare. I summarize some of them, such as treatment recommendation. So if you, for example, understand the genetics of disease, which I mean the AI can help the clinician to recommend treatment, provide more accurate diagnosis. So genetic of disease, which is sometimes is complex, if AI can help the clinician to understand that one, it can easily help also clinician to recommend treatment and provide more accurate diagnosis if you need it for diagnosis. And genomic data, for example, phenotype prediction from genetic data, including complex traits such as height as well as disease risk. You can, from genomic data, if your father has, for example, kind of disease related to cancer, or if your genomic has some indication of the such kind of disease risk, you have a risk factor of something of some disease. If you detect it in an early stage, that will be very useful, and also can be used for drug discovery, application of deep learning, for example, in compound priority and activity prediction, which can help also for in health in drug discovery. The last one is medical data fusion. Is you have a lot of data from different image, text data, and if you can fuse them together, if you can squeeze them together into a single multi-task learning, so you can have like prediction more precisely than having just from single sources. However, even though we explain a lot of potential for AI in healthcare, but also still there is challenges which need to be addressed to make this hope comes true in the future. The main things of that challenge is the data. As we say, the data is the main and essential part of training any successful deep learning or AI model. But also creating data is not something very easy. You have to be careful when you are creating data, is that your data should be representative and diverse. For example, you cannot claim that your model is very powerful and accurate if you just simply collect data, for example, from one hospital. And if you come at the end, that one hospital have a specific, for example, patient, or the patient that are coming there are not different from different race, from different background, from different. So the way of collecting data should be diverse and representative. So when the machine learning model or deep learning model learns, it learns to generalize. It does not it does not bias itself to specific type of data. The most aim or general aim that we need to achieve is to have a generalized model. If you apply it anywhere, you will get the same result. Sometimes also the hub behind big data is need to be also kind of investigated, because large data of the same kind may not help. If I have 10,000 images but they have the same patterns, that cannot sometimes help. Maybe if 1,000 of them are enough. So we need again to make big data but also at the same time representative and diverse. The fourth one is annotation. The third one is annotation guideline and expert annotator. Sometimes some complex data, the annotator themselves, they are not agree in some disease analysis or outcomes label. So we have to ensure there is annotation guideline every annotator or expert annotator should follow. So to ensure we are at the end of the annotation process, we are having high quality data. And sometimes also bias towards the data. Sometimes if we are collecting data from specific hospital that only visited by rich people, that at the end of the day, if you are going there, I mean poor people is going there, then the algorithm may say, okay, based on his income he is rejected, he is not admitted here. So this kind of bias is in data itself. Sometimes if you are collecting data and you end up with a lot of information, the algorithm learns, and it learns also bias. That bias is created also by human, but it should be avoided at the beginning of creating the data. And also, one of the most challenging and demanding of achievable machine learning or applicable machine learning for medicine is to create some kind of machine learning that can be explained easily. Why we need the machine learning to be easy to be explained? Actually, in healthcare in specific, we need some kind of understanding how the algorithm itself reach that selection or classification. Okay, I'm saying that he will get a cancer. I'm predicting the risk of cancer for a specific patient. But why the machine or the model predicts that risk, he is getting risk of cancer, for example, at age of 50, for example. What is the reason behind that? We don't need sometimes the outcomes. We need the process that reach the outcomes. The process itself is very important because we need to understand the process, so we need to make a recommendation and early treatment. Without understanding the process of reaching the outcome, sometimes the outcome itself is not useful. Also, and making the machine learning model more easy to explain, or can be explained, is to finding the prediction errors. We need to say error because error sometimes even it's 1%, but is that 1% related to maybe disease with high priority disease that's very important disease? We need to correct that error, whether, because if it is like black box, you don't know where is the error is, so you need to make kind of prediction error analysis and discover where is that error to correct it and to avoid it in the future, even in a small error type. Also, we need to finding bias towards, for example, racial differences or background differences or social differences. This kind of bias exists in current electronic health records or any type of medical data. So you having machine learning that can be modified and can be explained easy to avoid this bias in the future. The another challenge is it's kind of future direction and also challenges. We have like multi-modality electronic health records. We have like numerical values such as lab tests. We have free text clinical notes, continuous monitoring data like ECG and EEG, medical image. I mean, a lot of different types of data is very useful if we understand it, but it's kind of difficult when you analyze this. You have data from different sites and you have to create some specific aim, and you have to extract specific information from each type of data that serve your objective. Irregularity in electronic health records is one of the issue. For example, irregular sample, irregular visit, because you cannot come by if you have modeled some machine learning in specific patients. But patients and human are not similar. Some of them they will visit the hospital several time and several way, and some of them they will visit, and they have like irregular sample from their records, and you cannot model algorithm sometimes in a specific patient and you apply it in the future in different patient with different type of irregularities, and there is difference between both data. And there is also missed files, incomplete, the similar way incomplete and data that they have in their records. And they have also, when we talk to clinician, they are suffering from kind of copy and paste practice. Sometimes they copy clinical tool from one place to another, which is creating some simple error, but it's kind of very difficult for deep learning to understand it's a human error and how to avoid it. Another also challenging in when we are okay, we build a machine learning algorithm, we build deep learning algorithm, but how we can know this algorithm is powerful? So the simple answer is we are going for evaluation metrics, for example, accuracy, area under curve, and precision, recall. But these metrics sometimes are not really good enough. For example, accuracy. If you are using accuracy and you have imbalanced data, then you run to a problem, because you will get like, if you have a disease like in your test data, like normal is 9,000 and you have 1,000 or 500 non-normal. So if your prediction or system decide to give them all of them normal disease or no disease, then you end up with like approximately 90 to 95 accuracy, but your model did not predict anything. Even this can be avoided simply by using another matrix like area under curve, but it still should be also understood before starting to evaluate your model. Another thing also which is very important, you predict something, and with 99%, okay, your matrix is static. Okay, I have like accuracy of 90%, I have precision like 99, or if major 99. But when did I predict it? If I predict it at time equal to, for example, 0, the patient, and for example in ICU already he is dead, you predict he will get heart attack, but at that time you already did. You need to predict it like 12 hours or 10 hours or 13 hours. That's what clinician suggests. He says, okay, we need to predict it like 12 hours. This is enough time to save his life. But if you predict it after that, that's not useful, even if you predict it with 100%. Also, we need a ground of truth. The third format, ground of truth. Okay, we have this accuracy based on the annotator, but how the annotation guidelines went, and how the quality of annotator or annotation is, how good is it? Another also challenges is kind of ethical challenges, is related to data privacy, especially for healthcare. You have information about patient, and that need be to de-identify in order to process it in a good way. Also, another ethical issue is that predicting whether an individual receive, for example, surgery may be biased toward those who are able to access and afford the procedure. For example, okay, the machine learning has learned, okay, I am recommending surgery only for those who can afford it. Based on the previous records, only with high income people are recommended to have a surgery, otherwise they will not. So how we can avoid these ethical challenges? And the third one also is to if, for example, if the patient or somebody says that he doesn't want to say whether he is smoking or not. But sometimes smoking factor is very important, for example, for lung cancer prediction. So some data scientists trying to infer or trying to predict the missing factor, for example, like smoking. So how that one can be ethically understood if the patient does not want to say he is smoking. So why the researcher need to predict that factor? So more another challenges is kind also is future potential, and it is kind of opportunity rather than challenges, is to have like collaboration between both computer scientists and clinician. It's hard for computer scientists to understand all the terms related to clinician. It's hard for them to develop just algorithm without understanding the goal of that algorithm. They need to get in touch with the clinician to provide them what really they need and what is the ultimate goal of having the model. As a conclusion, in next few years, deep learning and AI will have a potential and a great impact in healthcare. To over that and to overcome the challenge will enable the development of practical models, and we will see some really practical and cheap and accessible to a lot of people, and especially for those people in outside of the city, or they can't afford very expensive like kind of scanning or some kind of imaging, medical imaging. Researcher can either develop a novel, I mean, this is the direction with the researcher, with regard of researcher. Researcher can either develop a novel methods for addressing the recent healthcare issue, or use the existing method to solve current unsolvable issue effectively. There is a lot of opportunity whether you can apply existing method to solve, or you can come up with a novel algorithm to address the recent healthcare. So we go for the question now. I think I did not get exactly what is the question exactly. Uh, Maybe you can have like Zoom discussion after this. And then thank you so much for your time. It was my pleasure to have this time and brief discussion. And we can continue if there is anything we can continue. You can contact me through my email. Thank you so much.